Good. Thank you.
You're welcome. Okay, so Lisa, this is our COVID questionnaire. It's a simple yes or no question. I'm gonna need you to fill it out, okay? Thank you. Okay, check your temperature. 98.2. All right, coming back.
Thank you.
Okay, so now you can have a seat and Dr. Coy will be with you shortly.
Thank you.
Hello everybody, this is Dr. Coy Ibrahim with Goals and Spine Rehab Center. I'm in North Lauderdale, room 2, with the patient. As you saw earlier, we are practicing all of the best guidelines for COVID-19. We are doing our screenings, we are doing our temperature checks, washing hands, just making sure our social distancing is at its best. And we are just making sure that all patients that come through the door are properly scanned and ready to go. And so right now I have a patient here, Lisa, and she's here for chiropractic care and physiotherapy. And today we're going to highlight her and ask her what brings her in today.
Well, I sprained my knee about a month ago, and I'm back here to have Dr. Coy to recheck my knee. And I do have back pain. I suffer with low back pain, and right now I'm also experiencing some pain in my right shoulder and neck.
So with the neck pain, the back pain, what are the contributing factors? What provokes those pains?
Well, a few years ago I did have a car accident that I did not get treatment for, and I believe that's what the reoccurrence of the pain is coming from.
Okay. And how about the knee pain? You said you sprained the knee. How exactly did you do that?
A funny thing, I was on my knees praying, and I got up, and I believe my body went one way, and then my knee went the other way.
Okay. So the neck pain right now is at a scale on a scale 1 to 10. What is it today?
I would give it a 5.
Okay.
It's very uncomfortable.
And point to where you're feeling that pain.
Right over here.
Okay. Probably on the right side.
Right.
Okay. And then how about the low back pain?
Constant back pain.
Okay. And point to where?
Right here.
Okay.
Down here.
Right in the lower part of the back where the belt line is.
Right.
And then the knee pain.
A little swelling from the sprain. Yeah, so it really hurts right over here.
Okay.
It's a little sore still.
Okay. Got it.
Yeah. And there's a little swelling as well.
Good. So today, primarily, this may be a 2-part video actually, because we're going to address the neck and the back pain with chiropractic adjustment. And what will be a good thing too is we'll come back and do some physiotherapy for the knee and see how we can improve the pain and discomfort and improve your function. So let's get started. So today what we're going to be doing is scanning the whole body at this point, and I'm going to go from the bottom to the top here, making sure we find areas of subluxation, misalignments that are causing dysfunction within our body, pain, and we're just going to get started. So as you can see right here, just checking their leg length. The leg length on this right side is very much different than the left side. We got some shortening on this side here, and the short leg is longer as I bend these knees here. So we gotta really check not only the ankles, the knees, also the hips. So this right side definitely feels. How do you feel when I press in?
It's a little painful. I feel like Very tense.
Very, very tense, right?
Mm-hmm.
Yeah. Any tenderness here?
Yes.
And how about here, Lisa?
No.
No. Any tenderness here?
No.
And how about here?
A little bit.
A little bit.
Mm-hmm.
So we've got a little bit of issues going on there. So we'll do a little stretch here. So turn your head to this side and lay it down for me. Okay, now turn your head to the opposite side and lay it down. And back to the middle. Okay, you're gonna be laying down on this side, face me. And then closer. And straighten that leg out for me. Bring you over. I got you. We'll give you a little push on the hips here. See here? Good job. So go lay on the other side. Felt that, right?
Yes, I felt that.
Center. Oil into January spine. Wanna make it go fine. Turn up the light, turn it up, turn it up, turn it up tonight. Yeah, 'cause you deserve the best.
Oh. Oh my God. Oh.
So I'm being pretty good today because usually I take the socks off, but she probably won't let me take her socks off.
I don't care if you take my socks off.
You don't care?
I don't care.
You sure?
I'm sure.
Okay, well it's too late now. I'm gonna show the world your feet. So you feel all this restriction in your ankles, right?
Yes.
Yeah. So that could be a contributing factor to why you're having some of that knee pain, as well. So you got some pronation, which again, the next video we're going to be looking at your physiotherapy for your knee. Okay.
Oh wow.
Yes, you felt that, right? So Lisa, kind of explain, as far as what you do on a daily basis, yeah.
I'm at the desk a lot.
Yeah.
I'm sitting a lot.
Yes. Yeah. And so when we have that prolonged sitting, that's really a lot of compressive. Yeah. A lot of compressive forces on the lower back. So with these adjustments and stretching exercises, we want to make sure we restore the natural and the length of various muscles, address those tight muscles as best as we can, throughout the day. So that's what we gotta do. So you have to don't look like you're stretching. Yeah, most people do. Because even as I'm doing this, you see how that leg wants to rise up? So we got a lot of tightness in here. So throughout, the day, we have to get up, we have to stretch, make sure that we get those hip flexors, the quads, the hamstrings in their proper length. Yeah, so your hips are very, very tight. So that contributes to it too. So that's what you see how that leg wants to ride up. So again, next video, that I know we got that knee pain, but also we're seeing a lot of different areas where there's some tightness, and we have to really address those as well. Okay. Let's see here.
I'm very tense today.
Yeah, but not too bad. So we have a lot of tenderness on this right side. And this is where she was saying she's having some of that pain and discomfort coming in the shoulders. Her upper traps very, very tight, very, very tender to the touch. Trigger points throughout here. And a lot of those muscles, they connect all the way from the base of the skull all the way down into the neck here, all the way down to the shoulder, I'm sorry.
Could that be the reason why I have legs?
Oh, absolutely. So a lot of tension in what we call the suboccipital muscles, all the way right here in the back of the head. You feel how tender this is, right here in the back. So we're feeling all right here at the base of the skull on the right side here. Very tender, right?
Yeah.
Yeah, and in comparison to the other side, if I press here, you see how much different that is? Yeah, very much different. And so the goal here is, we scan, we analyze and locate and correct vertebral subluxations. And we use the fingers, we use our palpation skills, we use all different means of finding where these subluxations are, and we adjust them properly. So even down here in this region as well. So I'm just gonna adjust here. So you just nice and relaxed here.
Ooh.
Good job.
Oh.
That adjustment just moved your mass, didn't it?
Yes. It felt good though. It felt good.
Yeah, so just relax here. Very good. Okay. So just rest there for a moment. Just relax.
Sleep here right now.
Feels good?
Yes, really good.
Good.
First, I want to say thank you, Dr. Coy. I'm feeling like I'm on cloud 9 right now. Whatever he just did, the adjustment for my neck. The adjustment for my neck, and it feels really, really good. And I for one was one that was afraid of getting an adjustment.
Why?
Because I saw someone cringe, and it made me afraid.
It could be intimidating.
Yeah, but stepped out on faith, and now I love it. It was really good. As far as the adjustment for my neck, once you get an adjustment, you immediately feel like a relief. You feel the pressure. Like I did have a minor headache. I don't have it anymore. My lower back, awesome. My ankles, my toes, I feel good overall.